Hi, everybody. It's Dr. Carrie Reller. Welcome back to the Get Healthy Tampa Bay podcast. Today, we have a very special guest, Dr. Vivian Asamoah. I should have asked you how to say your name, but maybe you can help us.
Asamoah.
Asamoah. Okay. Welcome to the podcast. Why don't you tell us a little bit about who you are and what you do?
Hey, guys. Thank you so much, Dr. Reller.
Yes.
For Thank you, Dr. Reller, and thanks to your entire audience for hosting me on the Get Healthy Tampa Bay podcast. I'm really happy to be here. My name is Vivian Asamoah. I am a gastroenterologist based out of Houston, Texas. I'm in private practice. I've been in private practice for over a decade. We practice a different kind of gastroenterology care because not only do we do conventional, screening colonoscopies and managing patients with acid reflux and diarrhea and constipation, but we add on a more integrative, holistic, and functional medicine approach to our care in trying to get to the root cause of disease and helping our patients with chronic gut issues establish a healthy relationship with food and enjoy eating food again. So that's how we're a little bit different, and we love what we do.
Definitely a unique concept, especially in the gastrointestinal space, I think. I mean, in our area, I don't know of anybody that does this model that you do. And I think it's super important and it can help people, like you said, get to the root cause of the problem, which is awesome. Today, I think we were going to talk about non-alcoholic fatty liver disease. I figure we just dive right in.
Yeah.
So can you tell us what it is?
So non-alcoholic fatty liver disease, it's a mouthful, right?
Mm-hmm.
In short, it's whenever you go to your primary care doctor or your gynecologist or whoever care provider is working with you, could do some blood work or order an ultrasound. So the two most common reasons why someone gets referred to me is because doctor does blood work and the liver enzymes are a little bit high. And the liver enzymes, also called hepatic function panel, is what you'll see when your doctor orders that comprehensive metabolic panel. It's like AST, ALT, alkaline phosphatase, sometimes total bilirubin is higher. So it's flagging in red. And so there's an elevation there. And sometimes it is when your doctor orders an ultrasound, which could be just for any other reason. Maybe you're having belly pain or they're checking something out. And the sonographer or the radiologist actually writes that they're seeing mild, moderate, or severe fatty liver. And then, patients are usually like freaking out. Like, what do you mean? What is this fat doing in my liver? Yeah. So that's how we usually have patients come to us. So non-alcoholic, because alcohol in itself can cause fatty liver. So if you went on an alcohol binge with your girlfriends for a weekend to Vegas and you were drinking all weekend, if you did an ultrasound the next day, we'd probably see some fat accumulation in the liver. And if we did blood work, we would see some of your liver enzymes jump up. So we make this distinction between, is this alcohol related because this person is either a chronic drinker and drinks regularly, or had a binge episode, or is this non-alcoholic where we really don't feel like this person drinks enough or even regularly enough to have this degree of fatty liver. And right now we are actually redefining the term to metabolic fatty liver, because before we used to say, this is just fatty liver because we can't find any other reason. So your doctor would do all of this blood work, checking for hepatitis B and C and checking for autoimmune causes of the liver issues. Your doctor may actually scan your blood work and your medication list and see, is this person taking something that's causing liver enzyme elevation? And then we would say negative, 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 none to all of that. This person most likely has fatty liver. However, today, we feel that as, gastroenterologists and liver specialists, we are able to make the diagnosis of fatty liver in addition to other coexisting liver diseases that may happen. So someone may have hepatitis B and fatty liver, right? And it's not an exclusion criteria anymore. It really is, we're seeing more of it's happening concomitantly. It's happening together with other issues. So now we focus on, is it possible that this person just has fatty liver because they have high blood pressure that's not well controlled? They have insulin resistance or diabetes that is not well controlled. They have hypercholesterol or hypertriglyceride. That's when your lipids are high. And this is someone your doctor, like Dr. Reller, would notice and pick up on, well, this person has all of these risk factors for metabolic syndrome. And if I'm seeing a little bit of fat in their liver, or if I'm seeing elevated liver enzymes, it's possible that they have fatty liver. So even though there may be something else, it's not an either or. It's like, I can tell this person most likely already has fatty liver.
So the exclusion of alcohol maybe rules out alcoholic fatty liver. And that's usually by history, not necessarily by something that you're seeing or lab testing, right?
Absolutely. So
By
you
history.
could have, as you're saying, Dr. Riley, you could have an alcoholic, but who is also overweight, diabetic. So they have both. It's alcoholic and non-alcoholic. It's metabolic fatty liver with alcohol, chronic liver disease as well.
Okay. And I wasn't aware of the new terminology, but it completely makes sense. And sometimes the patients may not know this, but when we approach these liver problems, I almost feel like it's alphabet soup, because you got NAFLD, AFLD, NASH. So I think we'll go into some of that, but now we have a new term to think about too.
Well, I think it's also because the non-alcoholic, alcoholic was kind of judgy.
Right.
You know, people are like, which one do you have?
Right.
So
I get that.
Yeah.
So you mentioned, I guess, some of these things that could be the causes of it. So is there anything you want to elaborate on how the mechanism happens?
Yeah. So we believe that fatty liver is really just another clue or another symptom presentation of metabolic syndrome, which we're seeing a lot of in our society, in our Western society today. And most of this is driven by insulin resistance. And that is really stemming, majority, I would say, is stemming from our diet. It's that standard American diet, heavily processed foods, lots of carbs, not enough good fiber, right? And that's causing high blood pressure, insulin resistance, diabetes, high cholesterol, increased weight, especially the weight around the belly, what we call the visceral fat. That's the weight around the trunk. And basically what happens, guys, is the weight around the trunk, that fat around the trunk seeps into the organs in the abdomen. So we talk about fatty liver because the liver is a large organ in the abdomen, but we also see fatty pancreas. And we see fatty tissue and other tissues as well. But fatty liver, because this fat in the liver can cause a lot of damage to the liver. And then it's a perpetual cycle of this insulin resistance issue. So yes, a lot of patients come to us for fatty liver issues, but actually what we need to do as hepatologists is work really closely with people like yourself, like the primary care doctors and the endocrinologists, really the primary care doctors, to say, hey, we need to address this metabolic syndrome issue or the obesity or the overweight as a whole, because this is just a sign that the whole system is off.
And in your practice, do you do any like counseling on that, or is it mostly working with the primary care?
We usually end up doing counseling because a lot of the primary care is just sent to us, and we're like, okay, did you do any? So they usually say, oh, my primary care said just come over and I need to lose weight. And that's really hard, right? When you just tell a patient, go lose weight. So when we see our patients in practice, I think the first step, probably similarly to what you do, Dr. Rilla, is we focus on education. What is this fatty liver? What does it mean? And we really try to get them not to focus on just the fatty liver. Like my liver is fat, my liver is fatty. We let them understand this is a systemic problem. And we need to make sure, like, you know, your blood pressure is high. That makes fatty liver worse. Just the same things that we talked about. And so I think the first step really is education and letting them also understand that when you reverse or have a good handle on all of these other things, the fatty liver will get better. So giving them hope that this is reversible, you know, just like blood pressure can be controlled with medication and diet change, and diabetes sometimes just with diet change and medication. So we let them know, hey, this is all reversible. It doesn't necessarily have to get worse, but it can get worse. And so after that education piece, we now start talking about simple steps. And so we usually start by explaining, because I think very often a lot of people say, well, can I eat fat? if I have fatty liver? So that's
Mhm.
the first question. We have like a little frequently asked question. So we start there and then we say, yes, you can. You have to eat the right types of fats though, right? Not trans fats, not fats from processed foods, but really foods rich in omegas. And
Mhm.
then we give them a list. We have like a little, and I can share that with your audience. We have a little fatty liver handout, like the best foods for fatty liver that helps for fatty liver, right? What you can eat. Then we talk to them about carbs, right?
Mhm.
Good carbs and bad carbs, avoiding all the processed stuff and focusing on grains and whole wheats and long acting, yeah, exactly, carbohydrates and portion control and portion size. And then the third thing we bring in is we talk about intermittent fasting as
Okay.
a way to kickstart, because we've seen in many studies, clinical studies, that it really helps reverse insulin resistance and metabolic syndrome. So we start slow and then we extend it. And some of our patients continue doing intermittent fasting for life until they see that reversal in the weight loss.
Mhm.
So those are the first things we talk about in the first visit so that no one is overwhelmed. And then we usually will see them about 3 months later after we've done a little bit more workup in terms of the liver. We want to see, okay, is this fat causing inflammation in the liver? So we want to monitor the liver enzymes and we calculate something called a FIB4 score. So that's FIB4 that tells us whether there is a risk of this patient having scarring in the liver, because when you have scarring and scarring and scarring and scarring, that goes and leads to cirrhosis, which is like a whole little shriveled up liver, right? Which then stops working well. So once we calculate the FIB4 score, we figure out, okay, do we need to do more testing, which usually is like what we call an ultrasound elastography or fibroscan, or even an MRI elastography, to see whether there's scarring and whether we need to really maybe even consider a liver biopsy. Now, what's interesting is when you have fatty liver, some people may have high liver enzymes, but there's really very little scarring. And some people may have normal liver enzymes and there's more liver scarring. So the blood work alone does not tell us how severe or advanced the fatty liver and the scarring is. So that's why they came up with this FIB4 score. And then you move on to this like elastography, the fibroscan. And then if your fibroscan shows, so the fibroscan goes from like F0, which is fibrosis, which is a fancy word for scarring. F0, like there's no scarring. That's like, yes, no scarring. It's just fat, totally reversible. Then it goes to F1, that's like a little bit. And then F2 is like a teeny bit more. And then F3 is like, there's quite a bit. And then F4 is like, this is cirrhosis. This is advanced, right? So if the ultrasound elastography shows us like an F3, moderate to severe, I usually proceed and biopsy the liver so that I can get definitive answers for my patients. And the reason why is because, as I said, we don't have good blood tests to really see how advanced this is. And in my practice over the years, I've seen a lot of people come in and say, yeah, I was told I had slightly elevated liver enzymes for like years. And then when I see that, I'm like, you have cirrhosis right now. Like this is advanced. This has not been monitored. You have cirrhosis. And cirrhosis takes us into a whole different chapter in liver disease and hepatology, right? The care is very different and the possibility of complications is very different, right? So I guess we're talking to say that all this to say that you can go from a reversible fatty liver, which is totally reversible, right? If you cut back and lose weight and exercise, to having cirrhosis, which is scarring of the liver, just like someone who was an alcoholic and has scarring in the liver, which is non-reversible, which can then over years increase your risk for liver cancer. So it starts off with something that just like, whoop, it's a little fatty liver, to the potential of even having liver cancer. And we're talking a lot about a fatty liver right now, Dr. Riller, because it is kind of an epidemic. It's following the graph of the obesity epidemic. And we're actually, amongst hepatologists, we know that fatty liver is now the number one cause of liver transplant. It used to be hepatitis, viral hepatitis B and C, and then alcohol. And now it's actually fatty liver leading to cirrhosis. Some of the reasons why, one of the foods or items that we know is directly correlated with fatty liver is high fructose corn syrup.
Mhm.
And this is in every soda, like most sodas, unless you're checking and reading labels. And, the last time I drove by McDonald's, I didn't go. I just drove by because it was near the CVS. There was a 2-year-old with a 16-ounce cup. I mean, this kid he was just like wobbling along with a 16-ounce cup. So if this 2-year-old is drinking soda, which contains high fructose corn syrup, and they hit 40, they've had almost 40 years to damage their liver. And so we are seeing more and more elevated liver enzymes and fatty liver in kids. So by the time they come to me, there's cirrhosis.
Right. Yeah.
And that's why fatty liver is going to be the number one leading cause of liver transplant.
It is or is going to be?
Oh, it is.
Oh, okay.
Yeah. It's surpassed already all the other
Mhm.
hepatitis. Yeah.
Yeah. So you've answered a lot of my questions already. So this is great. But I think key points, right, are that it's reversible if you're catching it early enough. Your doctor who's doing your lab work may be able to see if you're possibly having that. I have also heard that while our labs report back a certain level of normal of the liver enzymes, that they actually might want to skew that to lower and include more people as having elevated liver enzymes. Like basically they're seeing damage and they want to move the liver enzyme normal range to a lower amount. I don't know if you have any comment on that. Have you heard anything
so
about
the
that?
lab standard deviations are different and the
Right,
cutoffs
yeah.
are different. So from our standpoint as liver specialists, we think 20 is normal, 18 to 20 is normal. But when you look at certain panels from certain lab companies, they're saying up to 40 is within range. So that gives us a false sense of security that, oh, I'm not in the red yet, but you are actually higher than you should be.
That was something, I was trying to point out, but you did it much more eloquently.
No, I got it. I
Yeah.
got exactly that.
Right. So for making a diagnosis, first thing might be getting these labs, seeing that they're abnormal, maybe waiting a little bit, repeating them, make sure they're still abnormal. But obviously that doesn't supersede intervention of the things that you mentioned on lifestyle changes, because there's probably something else going on too anyway. Right. And then either referring to you guys or getting a fibrous scan or just a right upper quadrant ultrasound of their abdomen and seeing what that shows. And then the next steps would be, you were saying, depending upon their FIB-4 score, that they would possibly need an actual liver biopsy as well.
Absolutely. Yeah.
And then in the later scores and whatever the biopsy shows, if it's really not scarred yet, it's still quite reversible, correct?
Absolutely. Anything less than an F3 is quite reversible. Yes. Yeah, absolutely. Everything you said, spot on. I think that a lot of fatty liver initially is best managed by your primary care doctor or your internist or whoever you have that close relationship with in terms of your physician. Because many of the things they have to manage, we as gastroenterologists and liver specialists don't do, right? So we usually will say, let's make sure that a lot of patients are like, well, my doctor put me on a statin and should I take it? But it's going to make my liver number worse, right? And so I usually say, no. Actually, we want to control that. We want to bring your cholesterol down if you're really high and you've tried everything else. If you've worked through the diet, a Mediterranean diet preferable. If you're using omega fish oil and you're eating foods rich in omegas, and your levels are still high, then we absolutely recommend a low dose statin that is tolerable or whatever your physician recommends, right? And then, so we usually end up really saying, reach back out to your primary care doctor and let them handle, because the number one leading cause of mortality from fatty liver is actually cardiac. It's not a liver problem. It's because of the metabolic syndrome. It's a cardiovascular problem. So when I notice that the fatty liver is quite advanced, it just really translates that the metabolic syndrome is quite advanced. The insulin resistance is there. This is a diabetic patient. This is a high-risk cardiac patient, right? So I always want to make sure that they've had a good evaluation with their primary care doctor. An EKG is being done. Do they have family history of cardiovascular disease? Do they warrant more aggressive therapy in terms of their high blood pressure and cholesterol panel? Do they need to see a cardiologist? And this especially more so for a specific population, and that's our Hispanic population. We know fatty liver disease is a lot more common in that population. We don't think it's diet alone. We think there's a genetic component, and there are genetic polymorphisms that we can see in our Hispanic patients that we know definitely increase the risk of inflammation in the liver and fatty liver. So those are the patients that we want to, of course, with all, but even more aggressive and starting early with reversing metabolic syndrome when we can. Yeah, that cardiology eval is important. Yeah.
Yeah. Sometimes going back to the fructose thing and the children, I think that one thing I do like to explain to my patients is that fructose can only be processed in the liver, right? So it's not used by other cells for energy. It's only processed in the liver. And I try to really focus in on let's not eat these processed foods with fructose. Now, that doesn't include regular fruit, even though that includes fructose because it's packed with all the vitamins, minerals, and fiber that are okay and good for you, right? So really trying to get the kids off juice and soda is the biggest thing. And I know you mentioned that you're seeing little kids with it now, and it does happen earlier and earlier. And there are guidelines by the I think the Pediatric Societies that recommend now doing lab work on kids with obesity in order to check things like getting fatty liver disease under control early. So typically we don't do too many labs on kids, but when we're seeing these things, that's when it's time to pull the trigger and actually get some blood work.
Yes.
Especially looking for this. Yeah.
Agree 100%.
Yeah. So you mentioned a lot about lifestyle. Is there any magic medicine or anything that you think can help with this fatty liver disease?
Yeah, lifestyle is hard, right? Because lifestyle is all about behavioral change, which is why I think it's so hard to manage fatty liver disease. It's so easy to say, go lose weight and do exercise. But I think the whole thing is, I think we see more success when there's education. And there is a little bit of coaching, like a hand-holding process. So how do I get to the next step, right? I'm doing this now. So we start really slow. And if you're not moving at all, we say, how about just walking 15 minutes twice a week? And then up it. And just walking is good enough. You don't have to be running treadmill 1 hour at 6.0 or anything like that. Just simple walking is in itself, the studies have shown just 30 minutes, 4 to 5 times a week can help reverse fatty liver. So it's not that much, right? Yeah. And it doesn't have to be fast paced. It can just be moderate, brisk walking. And so that's important. And then with lifestyle, it really is a question of being able to read those labels, right? Getting back to reading labels, which a lot of us don't do. So actually looking at the ingredients and saying, okay, high fructose corn syrup, I can't have this. I usually say if anything has more than double digit sugar, 10 or more, can't have this, right? So really getting comfortable reading labels and just really starting simple and slow, and then incorporating the intermittent fasting. And very often it has to be a change in lifestyle, not just for the person, but their whole family.
Yes, that's very true.
Change, for the whole family, because this is probably a slightly genetic component as well. So if this is a Hispanic family, then I say all the family. It's not just you. Your husband probably has fatty liver too. So we probably should be checking that. So we try and incorporate and have as much coaching as possible with couples, so then they can also understand the risk factors for their kids as well. So you have to change not just for you, but for the whole family. So it's little by little. Sometimes we will refer if our patient is very overweight, or weight loss coaching sessions or a weight loss program. We sometimes, and I'm sure you offer that and something similar in your practice, Doc.
Yes.
So if you are lucky enough to have a doctor like Dr. Reller who can take on a lot of this and help you with the process, wonderful. You're in great hands. If not, yes, you have to get the help and try and reverse this.
Yeah, absolutely. So obviously, yes, in my practice, I do a lot of coaching and help with weight maintenance and weight loss. And I mean, I do use medications as well.
Mhm.
I think that some of those medications that are all over the news right now are actually going to have an indication for fatty liver disease pretty soon. But once again, it goes along with insulin resistance and metabolic syndrome that they're really treating that as well. And obviously treating obesity too. So that'll probably be something big when it gets FDA approved for fatty liver disease as well.
Yeah.
Yeah. And also I use metformin to help with insulin resistance too. And that can help get things started. I don't know what the effect is like on the liver. Do you know anything like studies on
So
that?
we haven't seen great effect in terms of reversing fibrosis on the
Okay.
liver, not even really in terms of liver enzymes. The one that had
Mhm.
the best results was pioglitazone, but that
Hmm.
caused some cardiac issues, failure and stuff. So we don't use it that much. I think we are probably looking at GLP-1s for
Right.
fatty liver. Our practice is doing a study on cirrhosis and GLP-1 and reversal of.
Mm.
Do we have to see reversal of a cirrhosis with GLP-1 use? So it'll be interesting to see what the whole study results look like, but we started recruiting for that. But yes, so no great treatments so far. What's in the literature is vitamin E, 400
Mhm.
milligrams twice a day.
Okay.
What's in the literature is vitamin D is extremely important for the liver and liver function. So making sure that your patients are well repleted, everyone has enough vitamin D. And the goal we try to get to is about 50 to 60. You know, again, that cutoff of 30 is normal, is kind of a low normal.
Mm-hmm.
Then from a holistic, more integrative standpoint, we've seen some studies on berberine and its effect on insulin resistance. So for some of our patients, we recommend supplements with a clean berberine in it, and that's about 500 milligrams 2-3 times a day. And then in terms of other supplements, so interestingly, you know, my love for the microbiome. So a lot of people with fatty liver have unbalanced gut microbiota.
Mm-hmm.
And so I usually recommend fiber,
Mm.
either in the form of a clean psyllium husk or a soluble fiber like benefiber or sun fiber or guar gum. I usually say incorporate this into your regimen every day. I don't know that there's data on probiotic, but I do give my patients probiotic, especially if they have constipation and fatty liver or IBS-like symptoms and fatty liver. But definitely, I think a quality fiber every day, in addition to increasing fiber in your diet, but we never get enough. So I think is so far what I've seen in the literature that could potentially be helpful.
Yeah, that's super helpful. I'm not as in tune with all the different supplements that can be used for a particular fatty liver. So I will have to include that in our show notes for everybody too. So what did we not talk about regarding fatty liver? Is there anything else that you want to focus on?
So something I learned, I don't know if your audience cares about this, but we always kind of connect fatty liver with metabolic syndrome. And I think probably 80 to 90% of fatty liver is from metabolic syndrome. But there's a component of patients with fatty liver who do not have metabolic syndrome. They're skinny, they have normal blood pressure, they don't have high cholesterol. So we think there's a possible genetic component, but studies have also come out. There was a large study published out of the UK last June 2022, that showed that organophosphates, which is what you find in pesticides like Roundup, also potentially increase the risk for fatty liver. And they're seeing a direct correlation between, you know, they kind of took a whole like thousands and thousands of people, looked at their exposures to environmental toxins, one of them being organophosphates. So there are some environmental toxins themselves that are contributing to the risk of fatty liver. Now, exactly how that's happening, we don't know. We clearly know there's an association, but we don't know if there's direct causality, right? But there's clearly an association. So if you Google that, it's interesting to know. And that could be potentially that 10, 15% that we're like, well, they don't really have the risk factors. So why?
Right. So obviously, if you don't know what to do with them yet, to counsel them if that
No,
was the cause, right? Yeah.
we don't know. No, we don't.
Yeah.
Yeah.
Well, is there anything else you'd like to share?
I think we've talked about a lot of things. I hope this was helpful to your audience.
Absolutely. Yeah. So where can people find you?
So you can find me on the web at drvivianasamoah.com. I'm also on Facebook. We have a private Facebook group called Natural Gut Relief, where we talk about everything holistic, functional medicine, integrative gastro care and gut health, and have different speakers on every Thursday at 6:30. So you're welcome to join us, and your audience is welcome to as well. And my practice is located in Katy, Texas, Houston, Texas. We do some one-on-one work, basically one-on-one consulting work for patients with chronic gut issues who have seen many different gastroenterologists and are not really getting to root cause and are seeking a second opinion and a more integrative and holistic approach. And so if you're someone out there who's seeking, I usually say, don't suffer in silence, reach out. There are a couple of GIs out there like myself. There are quite a few of us who are doing a more holistic, integrative approach, and we would be happy to help.
Awesome. Well, we'll include all that information in the show notes. And thank you, Dr. Asamoah, for coming on the podcast today. And I was going to say, I'm a member of your Facebook group. So I recommend it to anybody that if you, I guess, go along with the things that you were describing of who would be a candidate for joining it. So yeah, thank you so much for coming on today.
Thank you for having me. Have a wonderful day.
You too.
Bye.